As provinces continue to manage the Omicron BA2 variant that is dominating escalating case counts, messaging promoting a fourth vaccine dose continues, with no signs public health restrictions will be reinstated.
We're seeing that the test positivity rates have been increasing over time. We're seeing an increase in hospitalization admissions.
Dr. Brent Roussin, Manitoba's Chief Public Health Officer, says wastewater testing is showing COVID-19 transmissions and test positivity rates are also increasing. Roussin says at this time, bringing back mask mandates isn't a consideration. Instead, Manitoba has expanded eligibility for getting a fourth dose of COVID-19 vaccine, which he says still offers the best protection against the virus.
Those who are not fully vaccinated are 7.5 times greater risk of hospitalization, almost 10 times greater risk for ICU admission, and 32 times greater risk of death.
According to the Quebec government's most recent COVID-19 data, in the last 24 hours, there were more than 3,700 new COVID cases, with 64 people in intensive care. Alberta's most recent COVID data available shows 830 new cases, with 44 people currently in ICU. Ontario data shows COVID infections are also increasing from March to April, with case counts surging among children. Ontario Health Minister Christine Elliott said the surge was anticipated when the province removed mask mandates last month. The BC government says it will be loosening COVID restrictions on April 8th, with proof of vaccination no longer being required to access businesses, events, or services.
Restrictions and case counts are naturally correlated.
Epidemiologist Cynthia Carr isn't surprised that as provinces loosened health restrictions, COVID case counts went up. Carr says provinces started reducing public health orders when COVID case counts were not low by any measure. In Manitoba, COVID data will now be updated weekly instead of daily, which Carr says is a good thing and actually provides a more accurate snapshot of the virus.
So from an epidemiological perspective, it's really not a great idea to be presenting data daily, specifically when you're a smaller population. Those up, down, they're very confusing for people, and they can be impacted by many things, as we've talked about, like a holiday or a weekend.
What Carr would like to see is clearer messaging that could present provincial data on social media platforms in videos or animations. She says sharing COVID data in that way could increase public trust and vigilance around protecting oneself and others from the virus.
I've seen an example of a medical officer of health, for example, in Ontario, made a YouTube video. This is our new dashboard. This is what we're tracking. This is exactly how it works. This is how you go, so that people don't feel like there's been sort of a lack of transparency.
In Winnipeg, Mark Neufeld, City News.
In 1 minute.